Hi, my name is Dr. Khalima Bolden, and I am a licensed clinical psychologist and a clinical faculty member at UC Davis Medical Center. So I am going to talk a little bit about what I do, what I love less, and how I chose this job and how I got here. So I first started becoming interested in psychology when I was in college and undergraduate school, and I took a couple of psychology classes and really became fascinated with understanding what parts of the brain are involved in different behaviors, different thoughts, and how all of that works. So to become a clinical psychologist, you have to go to graduate school, which means you have to get a doctorate, a PhD or a PsyD. And from there, then you get to do a bunch of different things. Some psychologists work with companies, some psychologists see patients, some psychologists teach, some do research. And I am a psychologist who does a bit of all of those things. So I don't have a typical day in my job, so really I have more of a typical week. Some days during the week I see patients and I do therapy. So what that means is I talk to people about how they're feeling and what they're thinking, and I help them through some tough times. Sometimes that means that I will show them different skills to be able to manage what they're feeling and thinking. And sometimes that means that I just help them kind of be able to sit with what they're feeling and manage it in a way that's helpful to them. Some days I'm teaching, so I mostly teach medical students and undergraduate students about therapy and psychology, as well as how to be able to know when someone has, let's say, PTSD, which is post-traumatic stress disorder, or whether someone has depression or anxiety. And then other days I do research. So what that means is I have a lab and I have some lab folks who work with me and work for me. And we really look at different things that kind of help people, but also different things that contribute to them having difficult times or having some disorders. So what makes someone have PTSD versus someone who can go through the same thing and not have the symptoms of PTSD. So that is kind of my typical week, and I think the thing I love about my job most are two things. I love helping people and letting them know that it's okay for them to struggle sometimes. And I also love the science of figuring out what sorts of things make people tick, what sorts of things contribute to them doing well or doing less well. So I really love getting to ask different scientific questions and then coming up with a plan for how I'm going to answer those questions. The thing I love less about my job is it can be really hard sometimes to hear some of the things that people go through. It can make you feel pretty sad just to know that somebody else went through something pretty bad. And so that's something that I have to make sure I have really good friends and family around me so that they can help me out when I've had a tough day at work. So I talked to you a little bit about what schooling I had to do and what sorts of things I love, what sorts of things I love less. And then I think that the only other thing to talk about is how many times I get to really talk to young people like yourself about therapy and really working towards people don't think badly about people who have, different symptoms of different disorders. We call that stigma when people sometimes think poorly of those who have different issues going on and who might struggle with dealing with those issues. So I do a lot of talks at schools and at community centers, helping people understand that it's really normal to feel bad when certain things happen in your life, and sometimes it's just not easy to bounce back from that. Sometimes you need a little help, and that's my job is I give you a little help. So I hope that there are some budding scientists and psychologists in the class, and I hope that you start to think about what sorts of things happen in your brain that kind of produce some of the different things that you do, what happens in your brain that makes you run or that makes you cry. That's the stuff that I get to do every day, and that's why I really, really love my job. Thank you for having me.